cancers which are commonly being seen at Regional Cancer Center Gulu here. One of them is cervical cancer. Cervical cancer, these are cancers affecting, I could say, for a layman, the mouth of the womb, or the opening through which you can go to the uterus or the womb. This cancer starts from the cervix, or that opening or the mouth of the uterus, and then can now spread to the rest of the body. You know, cancer spreads. It starts from a particular area and spreads. Cervical cancer affects women only because women are the one with the cervix. And it is mostly commonly seen in women from 25 years to 65 years. Another cancer that we see here are breast cancers. Breast cancers are commonly seen in women above 40, but can also occur before that age, 40 years. Now we also see them in women. Of course, breast cancer occurs both in men and women, but more commonly seen in women than men. Liver cancer is seen commonly in those with heavy alcohol consumption, those who take alcohol excessively, chronic users, I would say. Also seen in those with infections, and these infections are infection with the hepatitis B virus and then hepatitis C virus. Again, it's also seen in those with exposed to aflatoxin. Aflatoxin is just, could say, is a substance produced by a fungus, and this fungus commonly grows in a poorly stored maize and granules. So if your maize is poorly stored or granite is poorly stored, this fungus will grow and then produce this toxin, and when you eat it, it can increase the chances of having liver cancer. There's a disease which affects also a liver. We call it liver cirrhosis. It's just a stiffening of liver, associated, of course, with the chronic infection with the hepatitis B, hepatitis C, associated with heavy alcohol consumption. But when you have that liver cirrhosis, it can progress to liver cancer or hepatocellular cancer. Another cancer that is commonly seen as here, we call them childhood cancers, with bucket lymphoma. Find a swelling, mostly presented like the swelling of the cheek, bucket lymphoma, and leukemia. Leukemia is a cancer of the white blood cells, so it's one of the lipid cancers that we have, affects the white blood cells. Another one, cancer that we see here commonly, like you ask, is a prostate cancer. So the risk factors is one of them is age, and age, but those ones, men, roughly from 40 years and above, the chances are high. And men who are 40 years and above, the chances are high. So always encourage those men to take screening, because there's screenable cancer. Of course, the family history as well can predispose somebody or increase the risk of prostate cancer. So those are the major cancers that we're seeing here. But other cancers are there, but those are the major ones we see here. Most of these cancers is preventable or treatable if detected early through screening or early diagnosis and care. Medically, cancer is a genetic disease. It occurs when our body cells grow and divides uncontrollably. due to genetic changes, like I said. So these genetic changes can be triggered by tobacco use, excessive alcohol consumption, infections, which are human papilloma virus infections, HIV infections, hepatitis B infections, and hepatitis C infections as well. Helicobacter pylori is associated with the ulcers, and many other infections can also cause these genetic changes. We have radiations, can be from the sunlight, ultraviolet radiation, or can be from the artificial sources of ultraviolet radiations. The indoor tanning, where we do, can also cause these genetic changes. There's some chemicals, arsenics, there's some environmental exposures that can cause these changes, genetic changes. So there's no scientific evidence linking cancer to witchcraft or any other supernatural causes. Can cancer be cured? The reality is, of course, layered, I could say. Some cancers can be completely cured, especially when it is detected early and treatment initiated effectively. We have some types of breast cancers, testicular cancers. They can be completely cured, but it should be detected early and effective treatment initiated. Other cancers can be controlled. I want to stress that, for many years with treatment. And that means a patient can live long, meaningful life with the ongoing therapy. And if it is not curable, but it can be controlled. A third category would be advanced cancers, stage 4 cancers that spread to distant organs. Assuming it has started from the prostate, has reached the liver, has reached the lung, or even up to the brain, are very difficult to manage. But still, treatment can reduce symptoms, treatment can slow the progressions, and the quality of life of the patient is improved. So, those are 3 goals for treating cancers: cure, control, then comfort. The patient has to be comfortable. There are also genuine reasons for the rising cases of cancers. We are calling really increasing cancer risk factors. When you compare recently, let's say early 2000s up to there, and compared backward, we're having many cases of chronic infections of hepatitis B, hepatitis C, human papilloma virus, which among the transmission, you can get them through sexual intercourse. I must say that our grandmothers, maybe not our mothers, our grandmothers used to engage in sexual intercourse when they were a bit older, let's say 20 and above. But currently, we have many young people who are exposed to these infections early enough for it to turn into chronic. Because sometimes, for example, hepatitis B, human papilloma virus, your body can have ability to clear it even from your body. But if it becomes chronic, it is when now it increases the risk of you having these cancers. So when you compared our recent past and the past before that, you realize that there are increases in these cases. That's why we are seeing we could be seeing number of cancer cases rising. There are environmental factors and food-related factors Aflatoxin is a substance produced by poorly stored maize, poorly stored granules. So if you have poorly stored granules, poorly stored maize, there's a fungus which grow on these poorly stored maize, poorly stored granules, and produces aflatoxin associated with the liver cancers. And we have seen the rise in that as well. We also seen, of course, rise, especially in rural areas, in indoor smoke from biofuel masses, which is associated with lung cancers and other cancers. But also I must say, still, lifestyle changes that we're seeing currently, you realize that there is increased consumption of tobacco products in some population, young people, even women these days. If you compared our women, let's say from Uganda or Africa generally, the consumption of these tobacco products were not as compared to the years before that. And that means that is already a risk factor which has increased. Increased consumption of alcohol. We see them among youth. Still also among women, it has increased when we compared to the past. We see changes in the diet. People are eating very highly processed, ultra-processed foods. Somebody will say first-class portion, and you're seeing the increase in the consumption of fast foods. Let's take, for example, the Rolex. When you see the salt put in Rolex, the quantity is much. See the oil put in Rolex, the quantity is much. So if you chronically eat this food like your routine, it can increase the chances. And we have seen the consumption. Look, there's so many other examples that I can give. We also seen reduced activity, physical activity. I come to office maybe on a board or maybe in a car. I may sit for like 4 or 5 hours sitting. I may take a border out, go and sit on a couch, watch my TV, watch my football. So the physical activity level is down. I'm eating maybe, I've eaten lunch here, I've eaten breakfast here, I will go there, maybe I eat supper at 8, at 9. But that energy, I'm not going to spend all of them. So that energy is going to accumulate in my body as fats. It's going to be converted into fats. And like I said, excess body fats can increase the chances of cancer. Early warning signs, I must say, should be taken seriously, should never be ignored. If you see the following signs, it is important to take them seriously, not to ignore them. One of the signs that should be taken seriously is unexplained weight loss. You're losing weight, but you're not dieting. You're not on diet. You have not increased your physical activity level. The loss in weight is coming very fast. It is within weeks you lost a lot of weight. Physically, you can be seen that this person has lost weight, or in months. You should be checked. Of course, the other diseases or infections, conditions that can bring about weight loss or severe weight loss. But this one I'm saying is occurring very rapidly within weeks and months. Another thing that also you should take seriously when you see is persistent unexplained pain. You see pain which is severe, getting worse over time, has taken more than 2 weeks, more than a month. Can be stomach pain, abdominal pain, can be headache, which is severe, Can be testicular pain, breast pain, but severe, has gone more than 2 weeks, a month, on treatment, you are not getting any improvement, it's getting worse. You could need to be evaluated, properly assessed for any. You could be having sometimes even brain cancer, brain cancers, brain tumors. That's important to be taken seriously, or another cancer from another part of the body. Another thing that you should take seriously is the unexplained swellings or lump. You find a hard mass, can be in the breast, can be in the neck, armpit, in the groin, a hard mass, painless, that is increasing in size. So if you see a hard mass in the breast, in the neck, other parts of the body, that is painless, it's increasing in size, it has to be, we always take samples of it. We go analyze it in the laboratory to see if there are normal cells or if there are cancerous cells. So any swelling should be taken seriously. Another thing is any abnormal bleeding, unexplained bleeding. Then you're seeing bleeding, which bleeding can be blood in stool or blood in urine, vaginal bleeding or genital bleeding. For the case of vaginal bleeding, it's outside, of course, period, or is after your menopause, but you're seeing the bleeding coming out of your genitals, vagina. It has to be taken seriously. The bleeding, you could say you're having nipple discharge. The bleeding could be pus. You could be having, you're coughing up blood. When you cough, you see blood staining your cough. So any unexplained bleeding or discharge should be evaluated. We have the skin changes. Could be psoriasis, could be some skin lesions, raised lesions. Practice doesn't heal, doesn't go away. Treatment you're not getting, but you find it there. Those sores are there. You have the moles on the skin. They say skin tag is increasing in size. The color has changed. The shape has changed. All these must be evaluated. You're having chronic cough. It's taken more than 3 weeks. Of course, can be evaluated for other conditions, but also, especially if it's associated with smoking, we need to evaluate it. There are people with difficulties in swallowing. They have bloating, frequently occurring bloating. Those people also should be evaluated. You have changes in the bladder habit or the bowel habit. You're having persistent constipations or diarrhea. You're having frequent difficulty in urination or painful urination. All these should be evaluated. So you should not wait to come to regional cancer centers. Local facilities can go there, they can do assessment, they can do confirmation of it, they can do the referral. But the most important thing is that most of these cancers are treatable, but it should be detected early. And when the treatment outcome is good, is better. And also when the treatment is easier, because you will see the outcome, which is better compared to when it's diagnosed late. Let's do regular checkup. In this case, we are focusing on cancer, and we have screenable cancers. We have cervical cancer, which is green, can be screened, and we do it here at Regional Cancer Center. And then also at lower facilities from level 3, they also do cervical cancer screening. We have prostate cancer screening, which can also be done. So men who are above 40, from 40 years and above, please ensure that you check the status of your prostate for cancer. Breast cancer can also be screened. You can do breast self-examination or clinical breast examination. So you first do clinical breast examination when a healthcare provider performs it. Then that healthcare provider can teach you every month to do breast examination or breast self-examination. Every month you should be able to check for any lump, for any abnormal skin changes, any distortion in the shape of your breast. All these are important. We can do something about it. We can do vaccinations for human papillomavirus. Girls who are 9 to 14, 13 to 14 years, they should be able to take up these shots for prevention of cervical cancer. Hepatitis B, we should be able to vaccinate ourselves. So vaccinations for these infections associated with the cancers is very, very important. We need to take that one up. What we can also do, let's also have these fruits. It's easily, we can plant them. You can have jackfruits, you can have oranges, you can have avocado. These are things that we can do. Pawpaw, all these are very, very important for our health. And these are the things that we can do because they can grow on their own. All you need is minimum manage. You just don't need much to manage a growing fruits or a growing tree which is going to become fruits, mangoes. Because from experience, you see, go to the community, somebody's having his home just bare without any fruits which can even still be used for shade. So we need to have these, our community should be able to have these fruits, plus vegetables taken together as part of our meals. We should reduce or desist from excessive alcohol consumption. For us to be able to fight this disease, we should desist from that because it increases our chances. And also tobacco use. We know, most people know cigarette smoking only, which is, but the other forms of tobacco can be one which can be chewed or can be even the e-cigarettes. Some of them have nicotine chemicals added to that. So all these we should avoid them, and we should also ensure that we come to health facility early. Instead of going to seek other alternative medicines from the community, it is important that you seek care from people who are qualified and people you can trust, people who can be held accountable, and those are the healthcare providers which we have in different facilities. Whether health center 2, a VHT can have some information to give you, refer you to health center 2, refer you to other higher level of care, or you can even come direct to Regional Cancer Center in case you have the suspecting that you could be having cancers. Thank you.